Short rib polydactyly syndrome is a group of bone malformations characterized by a narrow thorax and polydactyly, usually preaxial. This affects the rate of growth of a baby's ribs. It is a lethal birth defect, leaving the organs in the body to become defective. There are 4 types of short rib polydactyly syndrome, and they are very difficult to differentiate from one another. Some of the signs for short rib polydactyly syndrome are very short and horizontal ribs, cleft lip with or without cleft palate, short limbs, pulmonary hypoplasia, long tubular bone changes, cysts in kidneys, anorectal anomalies, central nervous system abnormalities, and severe micromelia. The symptoms for this disease varies on what type of short rib polydactyly syndrome you have. 80 to 90% of people have the following symptoms: abdominal bloating, abnormal pelvis bone ossification, abnormality of the wide portion of the long bone, short limb dwarfism, disproportionate, and lethal dwarfism identifiable at birth.
Short rib polydactyly is caused by a mutation of the WDR30 gene, which is received genetically as an autosomal recessive trait. The chances of inheriting short rib polydactyly syndrome has increased to 25%. This is a genetic disorder, meaning that it can't be prevented. There are no cures or specific forms of treatment for short rib polydactyly, and all cases of fetuses born with short rib polydactyly have had severe pulmonary hypoplasia, which is the incomplete development of the lungs and prevents survival outside of the uterus. Any documented cases of fetuses with this disorder have declared that the syndrome is lethal as well as unavoidable and unpreventable once detected. Since all babies born with this condition have died soon after birth, these newborns will never get to experience any sports or daily activities, which technically means that there is no impact on the lives of these newborns in terms of sports or daily activities.